Book 1, Unit 1, Physiotherapy, Exercise 5, page 5.
Watsonville Physiotherapy. Watsonville Physiotherapy is a private physical therapy practice. Our facility is fully equipped and expertly staffed. Each physical therapist on our team offers specialized knowledge. Our services include inpatient and outpatient care. Our mission is to rehabilitate patients suffering from injuries. We use stretching programs and state-of-the-art medical equipment to restore muscle use, maximize function, improve balance, increase mobility. We treat the cause, not just the symptoms. At each visit, you see measurable improvement from the previous one. If this is not the case, we revise your treatment plan. Watsonville Physiotherapy is a fully accredited facility.
Unit 2, The Body 1, Exercise 5, page 7.
Patient chart. Name, Michael Crane. Address, 107 Friendly Path, Simon, Wisconsin. 11955. Allergies, codeine. General health, excellent. Reason for visit. Patient complains of shoulder pain. He has also noticed decreased mobility. Pain radiates through bicep. He has noticed some back and chest pain. This is usually after exertion. Upper body, neck. Pain, some pain and tension observed. Mobility, NA. Upper body, back. Pain, pain in upper back after exertion. Mobility, NA. Upper body, chest. Pain, pain after exertion. Mobility, NA. Upper body, upper arm. Pain, bicep pain. No pain in tricep. Mobility, NA. Upper body, shoulder. Pain, pain observed. Possible damage to the rotator cuff noted. Mobility, some loss of mobility. Upper body, forearm. Pain, NA. Mobility, NA. Upper body, wrist. Pain, NA. Mobility, NA. Upper body, hand. Pain, NA. Mobility, NA.
Unit 3, The Body 2, Exercise 5, page 9.
The legs and lower body. There are several parts to the leg. The upper part is known as the thigh. The front of the lower leg is the shin. The back of the lower leg is the calf. There are two joints in the leg. They are the knee and ankle. They help the leg move. The foot is attached to the bottom of the leg at the ankle. Our feet allow us to walk, jump, and run. They also aid in balance. The toes are part of the forefoot. There are several large muscle groups in the lower body. The gluteals are located in the buttocks. The quadriceps are located on the front of the thigh. The hamstrings are located on the back of the thighs.
Unit 4, The Body 3, Exercise 5, page 11.
Structures in the torso. The torso refers to the central part of the body. There are various structures within it. The spine runs along the length of the torso. It keeps our body frame in an upright position. It enables us to have proper posture. The rib cage is in the upper torso. These bones support and protect the heart and lungs. The core is below the rib cage. The core's job is to stabilize the chest and pelvis. The lower part of the torso is called the abdomen. This is the body part at the front, between the hips.
Unit 5, Bones, Exercise 5, page 13.
What are bone fractures? There are 206 bones in the human skeleton. When a bone experiences too much strain or pressure, it breaks. The break is known as a fracture. There are 6 types. Stress fracture, hairline fracture. A small split in the bone. The fragments do not separate. It is caused by repeated activity putting strain on the bone. Green stick. These fractures are common in children. The bone is partly broken and partly bent. Displaced. The bone moves from its rightful place. Impacted. Broken bone fragments are driven into other fragments. Comminuted. The bone is crushed. Compound. The bone sticks out of the skin. Torn ligaments and bone marrow infections sometimes accompany a fracture.
Unit 6, Muscles. Exercise 5, page 15.
Muscles, structure and activity. Muscles are essential to physical functions. To understand these functions, one needs to understand their structure. Muscles consist of soft connective tissue. They also consist of muscle fibers or muscle cells. A bundle of fibers is a fascicle. A myofibril is a unit of muscle fiber. Each fiber contains proteins. Sarcomeres are other units of muscle. Each sarcomere contains long, fibrous proteins. Under a microscope, sarcomeres appear as light and dark bands. These bands slide back and forth as muscles contract. Muscles contract during physical movement. This occurs each time we stretch or flex. Elastic muscle fibers elongate or shorten during these contractions. After they relax, they resume their original position.
Unit 7, Muscular System. Exercise 5, page 17.
Muscle types and actions. There are 3 types of muscles. They include cardiac muscle, skeletal muscle, and smooth muscle. Cardiac muscles are found in the walls of the heart. They are involuntary with repeating sarcomeres. Cardiac muscles function like other body tissues. They use blood to deliver oxygen and nutrients. Among skeletal muscles, voluntary contractions produce movement. Contractions create tension, which shortens muscles. Tendons and ligaments also assist in movement. Skeletal muscles have numerous fibers. These include red and white fibers. They also include twitch fibers. Fast twitch fibers produce higher action potential. Smooth muscle is present in the vital organs. In the digestive system, these muscles help with digestion.
Unit 8, Joints 1. Exercise 5, page 19.
Syllabus, Physiotherapy 101, Part 1, Joints. Textbook, The Body Articulate, Simon University Press, 2010. General Learning Objectives. Upon successful completion of this course, the student will 1. Identify anatomy of the human joint system. 2. Describe systems of joint classification. Major joint types: A. Synarthrosis, B. Diarthrosis, C. Amphiarthrosis. 3. Describe the characteristics of synovial joints. 4. Describe the characteristics of cartilaginous joints. 5. Explain the convex-concave rule. A. Ovoid joints, B. Sellar joints. 6. Explain the concept of axis of rotation. A. Monaxial, B. Biaxial, C. Multi-axial. Course meets Tuesdays in Herman Building. Course lab every Thursday night.
Unit 9, Joints 2. Exercise 5, page 21.
Medical Dictionary. Types of synovial joints. Joints are classified in various ways. One method is by the shapes of articular surfaces. Examples include plane joints, a joint consisting of two flat surfaces. This allows for gliding movement. Hinge joint, or ginglymus, comprised of a convex and a concave articular surface. Trochoid joints, including pivot joints and rotary joints. One surface rotates within or around another. Ellipsoidal joints, or condylar joints, consisting of convex and concave elliptical joint surfaces. Saddle joints, with opposing convex and concave surfaces. Ball and socket joints, or spheroidal joints, comprised of a spherical bony head that moves within a socket.
Unit 10. Anatomical locations. Exercise 5, page 23.
Anatomical location. Examples. Superior. The elbow is superior to the wrist. Inferior. The knee is inferior to the hip. Proximal. The mouth is more proximal to the nose than the ear. Distal. The ankle is more distal to the chin than the forehead. Anterior. The quadriceps are located on the anterior portion of the thighs. Posterior. The calves are located on the posterior portion of the lower leg. Medial. The inner thigh muscles are located on the medial side of the thigh. Lateral. The ears are located on the lateral side of the head. Contralateral. The left hand is contralateral to the right foot. Ipsilateral. The right foot is ipsilateral to the right hand.
Unit 11. Body movements. Exercise 5, page 25.
Patient assessment form. Name: Marcus Reed. Details of injury. The patient fell on ice. He injured his left leg. Flexion and extension. The patient can bend and straighten the leg. This motion causes discomfort but not pain. Abduction and adduction. I had the patient swing his leg to the side. He experienced a stabbing pain. During adduction, the pain was somewhat less intense. Elevation and depression. The patient can elevate and depress his leg. Pronation and supination. Sideways or circular movement of the foot hurts. The patient states this causes the most difficulty. Dorsiflexion and plantar flexion. Limited dorsiflexion and plantar flexion are possible. This is below the typical range of flexibility.
Unit 12. Resistance Exercise 1. Exercise 5, page 27.
Why perform resistance exercises? Resistance exercise improves muscle strength and muscle power. Increased muscle strength allows us to perform actions. Examples include lifting heavy objects with ease. Greater muscle power helps us perform actions efficiently. Endurance also improves. Physical therapists recommend either strength training or cross-training. A PT's suggestion depends on a patient's needs. Both methods improve functional strength. However, cross-training improves overall fitness. PTs apply two principles during training. They include the overload principle and the SAID principle. The first challenges muscles with greater resistance. The second requires planning to achieve goals. If patients stop exercising, reversibility training begins. Detraining causes a loss of fitness.
Unit 13. Resistance Exercise 2. Exercise 5, page 29.
Exercise Program. Sandra Stewart, age 49. Week 1. Monday. Full arc exercises for the upper body. Perform 2 sets of 10 for each exercise. Use 10-pound free weights. Allow 2-minute rest intervals between exercises. Shoulder presses, bicep curls, arm rotations. Wednesday, short arc exercises for the lower body. Focus on exercising the knees. Practice leg raises, leg adductions, and leg abductions. No weights are necessary. Perform 20 repetitions of each. Due to injury, this is the repetition maximum. Friday, 2-mile walk on a treadmill. Speed 2.0 miles per hour. We may change the mode of exercise weekly. This depends on the patient's needs and motivation. Maximal loading is desirable for full arc exercises. Submaximal loading is best until the patient heals.
Unit 14, Aerobic Exercise 1. Exercise 5, page 31.
Aerobic exercise program. As part of physical therapy, we offer custom exercise programs. This is an important step on the road to recovery. Our program begins with a thorough assessment. After that, patients begin approved aerobic exercise. Deconditioning is common after injuries, so we usually start with light activity. We monitor energy expenditure and its impact. We also track maximum oxygen consumption. We slowly build up to moderate activity when adaptation occurs. Heavy activity should be avoided until conditioning returns. Our program lets you rebuild both stamina and health. Improve your fitness today.
Unit 15, Aerobic Exercise 2. Exercise 5, page 33.
Customized exercise program. Client name, Mateo Garza. Age, 32. Whenever you exercise, do a warm-up first. It needs to be at least 5 minutes long. Use the exercise bike at low intensity. Then do some dynamic stretches. Also, allow time for a cool-down period after your workout. Wear the monitor provided to track your heart rate. Monday, 45 minutes of interval training with active recovery. Tuesday, 1 hour of circuit training. Thursday, 45 minutes of continuous training. Choose between jogging and cycling. Friday, 1 hour of circuit interval training. Alternate between calisthenics and weights. Sunday, 1 hour of interval training with passive recovery. Rest on Wednesday and Saturday.
Book 2, Unit 1, The Diagnostic Process. Exercise 5, page 5.
Diagnosis. The diagnostic process is comprised of several actions and decisions. The first step is to collect data. This is done during an initial patient meeting or interview. A successful interview is necessary to develop a prognosis. Treatment goals. Identify symptoms, classify dysfunction, develop plan of patient care. Collect data that outlines a complete patient history. This includes both medical history and social history. Questions about lifestyle and occupation provide important information. Note whether lifestyle changes correspond with the onset of symptoms. Complete a systemic review. Begin with a chief complaint. Assess additional changes throughout the body. Complete an impairment checklist. Is the patient able to perform activities of daily living? ADL activities include self-feeding, personal care, and walking. Is the patient able to perform instrumental activities of daily living? IADL include shopping, house cleaning, money management, transportation, medication management, and communication. The level of impairment or dysfunction helps a PT define a diagnostic category.
Unit 2, Examinations and Diagnostic Tests. Exercise 5, page 7.
Name: Simon Walsh. Gender: male. Age 47. Presenting problem, current condition. Patient was admitted to the hospital yesterday to treat acute knee pain. The primary impairment is limited mobility and pain in the right knee. The underlying cause is damage to a previously torn ACL. Medical history. ACL tear 5 years ago. Medical diagnosis of osteoarthritis in knee joints. Level of dysfunction is mild to moderate. Social history. Non-smoker. Moderate alcohol use. Avid runner. Other information. Primary care physician recommends physical therapy to build muscle strength. MRI interpretation shows worn cartilage and joint damage. Examination. Tests were administered to measure goniometry, posture analysis, gait analysis. Evaluation. Analysis of test results provides an objective baseline. Strengthening exercises suggested in accordance with preferred practice patterns. Diagnostic category, musculoskeletal. Follow-up. Weekly appointments scheduled for 6 weeks. Additional treatment options are to be determined.
Unit 3, Actions. Exercise 5, page 9.
New patient questionnaire. Name, Stephanie Rishi. Details of injury. I was in a car accident and injured my left shoulder. Are you able to perform the following motions with ease? If the answer is no, please explain further. Also, indicate if your level of function has changed. Reach. No, I can reach forwards without difficulty, but it is painful to reach backwards. My range of motion is diminished. Lift. No, I cannot lift any weight over 20 pounds. Push. No, I experience discomfort when pushing open doors. Bend. Yes. Turn. No, I cannot turn my head, neck as far as before. All other turning motions are fine though. Roll. No, I am physically able to roll, but putting weight on my bad shoulder is painful. Stand. Yes. Squat. Yes. Grasp. Yes. Stoop. Yes. Twist. It depends on the motion. I sometimes feel resistance when twisting. Kneel. Yes.
Unit 4, Motor Tasks. Exercise 5, page 11.
Motor learning. Motor learning is the study of developmental processes. People go through many steps as they acquire and refine motor skills. There are many variables as this learning takes place. Make sure to consider the variables that promote or inhibit performance. Movement is the function of the interaction between 3 distinct elements: the learner, the task, the environment. Motor tasks are learned and they are classified in 3 categories. Discrete task. Individual task with beginning and end points clearly defined. Serial task. Comprised of a number of discrete skills whose integrated performance is necessary for goal achievement. Continuous task. Requires repetitive motion with no marked beginning or end. It is important to note regulatory conditions. Are conditions stationary and fixed? Is there intertrial variability? Do tasks require object manipulation? Do tasks become more complex over time? Work with individual clients. Determine a progression of learning experiences from simple to more complex.
Unit 5, Reflexes. Exercise 5, page 13.
Patient assessment form. Name Derek Klein. Date of birth 4/11/55. Reflexes explained. A reflex is just a nerve circuit. Testing a reflex tests the nervous system function. In response to a stimulus, signals travel to the spinal cord. From there, the signals move to the brain and nerves. Without help from the brain, the muscles may contract. The following reflexes were assessed: Ankle jerk reflex, 2+. Biceps reflex, 2+. Extensor digitorum reflex, 2+. Patellar reflex, 0. Stretch reflex, 2+. Reflexes are graded on a scale of 0 to 4. 0, absent. 1+, diminished. 2+, normal. 3+, hyperactive, without large involuntary motions. 4+, hyperactive, with large involuntary motions. While 2+ is normal, many individuals registered different results. Some people score all 1+ or all 3+. Other times, one area is abnormal due to injury. Your doctor will be in touch if a follow-up is necessary.
Unit 6, Outcomes. Exercise 5, page 15.
http://www.ptsolutions.com. At PT Solutions, we're interested in one thing: results. The only worthy outcome of physical therapy is recovery. Measuring patient satisfaction. There are measurable ways to determine quality of care. Each month, patients complete a survey. We use this to find out how we can improve. We may need to modify your therapy. We may need to adjust your schedule. Whatever your concerns are, we'll address them. Our goals. Our main goal is to ensure the best functional outcomes. We seek answers to 3 questions. Has the patient improved in a meaningful way? Has the patient regained practical abilities? Are the patient's improvements sustainable? We answer the first question by talking to your loved ones. We ask them if you've been able to function independently. We answer the second question by discussing your recent activity. Have you resumed your chores? Are you walking regularly? We answer the final questions during our intermittent follow-ups. We find out whether you've maintained good strength and coordination. These are quantifiable changes.
Unit 7, Patient Management. Exercise 5, page 17.
The PT Specialists. Our staff and services. For 20 years, we've proudly provided outstanding patient services. We hire skilled and experienced physical therapists. We also maintain up-to-date equipment in a spacious, modern facility. Our philosophy. Patient management requires skill and care in equal measure. The process begins with examinations. We then do evaluations of exam data. During this stage, we can make a diagnosis and a prognosis. If a patient's condition changes, we do re-examinations as needed. In consultation with patients, we determine the best course of intervention. Each patient is provided with a written plan of care. This document describes the course of treatment and expected outcomes. If re-examinations suggest a better course, we will change the plan. Here at the PT Specialists, we perform an evidence-based practice. We rely only on research. If our clinical decision-making is insufficient, we make referrals. The care of our patients comes first.
Unit 8, Risk Factors. Exercise 5, page 19.
What are the risk factors for disabilities? Numerous conditions cause disability. However, appropriate care can create buffers. The key is to know what those conditions are. One possible factor is biology. This includes a family history of congenital disorders. Abnormalities sometimes develop in the womb. Age, sex, and race can also predispose people to disability. Being elderly can sometimes make people more vulnerable. Unfortunately, little can be done to change these things. While people cannot change their ages, they can change their lifestyles. It's important to maintain good nutrition. It's also important not to be sedentary. Inactivity often leads to obesity. Sometimes people have difficulty finding the motivation to exercise. In this instance, it may help to hire a trainer. Fitness experts give us the coping skills we need to stay fit. Socioeconomic factors are more complex. People with limited income, for example, cannot afford trainers. They are also unable to afford healthier foods.
Unit 9. Common injuries and ailments. Exercise 5, page 21.
Welcome to Langman French Physical Therapy. Langman French is a group physical therapy practice. We hold ourselves to extremely high standards. We carefully assess the problem and devise a personalized treatment plan. We provide support along the journey. Let us help you regain movement and health. We have experience working with various sports injuries, twists and sprains, ACL and MCL tears and injuries. In addition, we specialize in helping with diseases that impair movement. We may be able to help if you suffer from the following diseases: arthritis, multiple sclerosis, osteoporosis, Parkinson's disease, cerebral palsy. We also work with patients who are recovering from surgeries like hip replacements. Our therapists regularly assist patients injured in automobile accidents. We are familiar with the necessary legal paperwork such cases bring. We do not specialize in patients recovering from strokes or brain injuries. However, we are happy to provide referrals.
Unit 10. Stretching. Exercise 5, page 23.
Stretching and physical therapy. Stretching improves muscle flexibility and joints range of motion, ROM. It sometimes alleviates hypomobility and contracture. There are 7 types. Static stretching. Elongates muscles. Patients sustain forces for extended periods. Cyclic stretching. Applies slow, low-intensity, controlled forces. Forces shorten muscles back to their original lengths. Patients need to apply gradual tension to avoid tearing. Ballistic stretching. Includes quick, high-intensity movements. Jumps and bounces are common. Forces the limb into an extended ROM. However, ballistic stretching can be dangerous. It can cause tearing. PNF, proprioceptive neuromuscular facilitation stretching. Simple techniques which enhance active and passive ROM. Self-stretching. Independent exercises that help reduce stress and pain. Manual stretching. Conducted with the help of a physical therapist. Applies force beyond tissue resistance and the available ROM. Challenges muscles to create greater mobility. Mechanical stretching. Uses workout equipment to assist with therapy. Devices allow more diverse options during rehabilitation. Health professionals determine intensity and duration. These factors are related to fitness levels and motivation.
Unit 11. Joint mobilization. Exercise 5, page 25.
Joint mobilization. When a bone moves, movement also takes place in the joint. The 2 bone surfaces which meet at the joint move against one another. There are several types of possible movement or joint play. These include rolling, sliding, spinning. These motions are often combined. For example, rolling may result in separation or compression. So in healthy joints, sliding and spinning would also take place. Joint mobilization is frequently used in physiotherapy. Do a thorough assessment of the patient to assess total range. Graded oscillation can then be used for joint mobilization. Grades 1 and 2 vary in amplitude but are intended to decrease pain. Grades 3 to 5 improve range of motion. There are 2 ways to do these oscillations: joint play or physiological motions. 3 dosages are associated with joint play techniques. These are sustained grades. Traction may be employed to cause distraction.
Unit 12. Improving balance. Exercise 5, page 27.
Improving balance. Many people have difficulty with balance. This can be due to an injury, illness, or simply the aging process. However, balance can be improved. There are several different types of balance. These are static balance control, anticipatory balance control, and reactive balance control. Patients may have problems with some or all of these. The goal is to keep the cog, center of gravity, or the com, center of mass, over the boss, base of support. A person's limit of stability increases the closer they are to the ground. Therefore, measure the COP, center of pressure. Then, start with static balance control exercises such as sitting. Then move to kneeling poses and standing. The body has several ways to fix balance issues. People can use a stepping strategy, ankle strategy, or hip strategy. Work with your patient to improve the above. We will also explore ways to work on linear and angular momentum.
Unit 13, Giving Feedback. Exercise 5, page 29.
Physical Therapy Workshop Series. Week 3, Feedback. Feedback is one of the most valuable tools for sensory learning. This workshop will include information about different types of feedback. We will also discuss patient communication. Sources of feedback. Intrinsic feedback is derived from the patient's own senses. This is the body's response to a task. Augmented feedback is supplemental to intrinsic feedback. It is provided by the physical therapist. Timing of feedback. Therapists must decide when to provide different types of feedback. Concurrent feedback is recommended at the start of the learning process. Immediate feedback is also frequently provided during the early learning stages. As the patient masters tasks, provide post-response feedback. This includes delayed feedback or summary feedback. Focus of feedback. Knowledge of performance is known as KP. This includes information about the nature or quality of the task. Knowledge of results is known as KR. It includes post-task feedback about the outcome of a task.
Unit 14, Aquatic Exercise 1. Exercise 5, page 31.
MetaView Physical Therapy, Aquatic Exercise Program. The Aquatic Physical Therapy Pool enclosure is a unique exercise environment. Our warm water pools make exercise easier and less painful. Water and air temperatures are controlled to promote body temperature regulation. Aquatic exercises use buoyancy and water resistance to improve results. Aquatic physical therapy also uses hydrostatic pressure. This can decrease swelling and improve joint position. Immersion in the warm water relaxes muscles and improves blood flow to injured areas. Exercises are based on the body's center of buoyancy, COB. This affects the body differently than the center of gravity on land. Benefits of aquatic exercise. Buoyancy provides relative weightlessness, decreasing joint pressure. The water's viscosity provides resistance, increasing the value of exercises. The water's surface tension can be used to provide increased resistance. Our therapists are trained to use unique exercises using hydromechanics. Daily classes are available. Contact our main office for a complete schedule.
Unit 15, Aquatic Exercise 2. Exercise 5, page 33.
Aquatic Exercise Equipment by Parker Products. Flotation devices and buoyant products for your patient care needs. Parker Products designs specialty equipment for use with aquatic exercise. Equipment designed to assist with patient positioning. Inflatable cervical collar, used for the supine patient. Supports neck and keeps the patient's head out of water. Flotation rings, available in many sizes. Rings are used to support the extremities while the patient is in an immersed position. Buoyancy belts and vests. Available in several styles and sizes. Belts assist with buoyancy of an extremity or the entire body. Strength and endurance equipment. Swim bars. Available in short or long lengths. Used to support the upper or lower body or to improve strength and balance. Hand paddles. Used to increase resistance in the direction of movement. Swim fins generate resistance by increasing the surface area as patients move through the water. Kickboards. Several shapes and styles available. Still the most versatile and effective aquatic exercise tool.
Book 3, Unit 1, Soft Tissue Disorders. Exercise 5, page 5.
Patient chart. Name, Chad Davies. Date of birth, 11/04/91. Location of injury. The patient has a partial tear of the left MCL. Severity of injury. Grade 1. Grade 2. Check. Grade 3. Visit date, 12th October. The patient presented with a partially torn ligament in the knee. He was injured during a football game. The injury is currently in the acute stage. I have classified this as a grade 2 injury. While the ligament is torn, the tear is partial. The patient is experiencing a typical inflammatory reaction. He complains of pain and the area is swollen. Due to the torn MCL fibers, I also observed increased joint mobility. I have provided him with information about soft tissue injuries. I also ordered him to rest the knee for a week. Visit date, 22nd October. The patient has made good progress. The injury is now in the subacute stage. Most of the inflammation has gone down. Pain is still present at the end of the range of motion. Function remains limited. However, the ligament has started to repair itself. Visit date, 6th November. The injury is in the chronic stage. Inflammation is totally absent. Maturation and remodeling have begun. I gave the patient a detailed exercise plan.
Unit 2, Bone, Joint, and Connective Tissue Disorders. Exercise 5, page 7. FAQ. http://www.ptsolutions.com/FAQ. What are bone, joint, and connective tissue disorders? They are diseases that attack the skeletal system. They also cause abnormalities in muscular and nervous tissue and tissues between cavities. What are some examples of these disorders? Arthrosis, osteoarthritis, and rheumatoid arthritis are common joint ailments. These conditions result in the deterioration of cartilage. Symptoms include pain, stiffness, and swelling. Joint damage often results in limited ROM. The sufferer is also more vulnerable to fractures. Fibromyalgia and myofascial pain syndrome are musculoskeletal disorders. The first condition causes pain in widespread areas. The second causes pain at various trigger points and constrictions in the fascia. How do we treat these disorders? We employ various methods. Of course, the ultimate goal is to restore the bone's strength. The damaged limb is placed in a cast. Immobilization is essential during the inflammatory phase. After a week, the reparative phase begins. At this point, woven bone develops over the site of fracture. Woven bone is weak and merely closes the fracture. During this stage, traction devices help to exert force on a damaged limb. This helps to strengthen the limb. Examples of such devices include slings and splints. Post-immobilization occurs during the remodeling phase. Additional physical therapy is required to restore normal functions. Unit 3, Nerve Disorders. Exercise 5, page 9.
Nerve disorders. Nerve disorders often cause nerve injury. TOS, thoracic outlet syndrome, is a rare disorder. It causes pain in the neck and shoulders, numbness, tingling, and a weak grip. TOS sometimes occurs in patients who have CTS, carpal tunnel syndrome. CTS and TOS share similar symptoms. Though CTS may also result in damage in Guillen's canal, CRPS, complex regional pain syndrome 1, and CRPS 2 are pain conditions. They result from problems in the central nervous system and peripheral systems. They share the same symptoms. However, CRPS 1 is caused by tissue injury. In contrast, CRPS 2 is always caused by nerve injury. Nerve injury results from compression, stretching, or laceration of a nerve. Signal transmission is impaired. Sufferers experience muscle weakness and numbness. The Seddon classification system and the Sunderland classification system recognize types of injury. Seddon's identifies 3 classes of peripheral nerve damage. This includes damage to nerves and surrounding tissues. Sunderland's expands classification into 5 categories. It uses Seddon's first 2 classes. The third includes nerve fiber interruption. 4th and 5th degree injuries require surgical repair. Seddon's system, on the other hand, does not include injuries which require surgery. Medical professionals cannot always be certain about the presence of a nerve disorder. To help with diagnosis, they may perform a test of provocation.
Unit 4, Vascular and Pulmonary Disorders. Exercise 5, page 11.
www.ptsolutions.com. Physical therapy to treat vascular, arterial, pulmonary, and lymphatic disorders. Physical disabilities increase the risk of vascular and pulmonary disorders. This is often due to a higher incidence of obesity and diabetes. At PT Solutions, we can help you find ways to deal with symptoms. Smoking often leads to COPD, chronic obstructive pulmonary disease. After patients quit, they must work to restore their lungs to health. Breathing exercises and cardiovascular exercise can help. Our trained professionals can help sufferers understand their disease and adopt better habits. Postural drainage techniques can diminish the harshness of coughs. Vascular disorders, such as deep vein thrombosis, DVT, can cause great pain in sufferers. Swelling is very common due to blockage. Low to moderate intensity exercises, such as climbing stairs or gardening, can help. We also introduce stretching exercises to relieve pain and help increase blood flow. These methods also relieve symptoms from arterial disorders, such as acute arterial occlusion. Venous disorders, such as varicose veins, are also addressed. Walking is helpful. It is important not to sit or stand for extended periods. Stretching and elevation exercises also relieve pressure on the legs. Injury and infection can lead to lymphatic disorders. Lymphedema is especially common. We teach patients a range of motion, ROM exercises to deal with swelling.
Unit 5, Spine Disorders. Exercise 5, page 13. Spinal pathologies. Impaired spinal function can be caused by injuries or degenerative conditions. A spinal pathology is any condition that affects the spinal column or spinal cord. The spine is the column of individual vertebra that comprises the backbone. It surrounds and protects the spinal cord. The vertebra that make up the upper spinal column are divided into 3 sections. The cervical spine supports the neck. The thoracic spine is the middle section of the back. The lumbar spine is the lower section of the spine, between the lower ribs and the pelvis. Intervertebral discs provide a cartilaginous cushion between each vertebra. Spinal pathologies are often caused by disc degeneration or injury. Examples include herniation, defines a change in the shape of tissue that causes it to rupture and bulge beyond its normal perimeter. Protrusion, a change in the shape of tissue that causes it to bulge while remaining within its perimeter. Prolapse, a rupture in a disc that causes the nuclear material of an intervertebral disc to leak into the vertebral canal. Extrusion, a degenerative condition caused when the nuclear material of an intervertebral disc leaks into the vertebral canal. Free sequestration, a serious condition where a disc fragment has broken free and moved. Unit 6, Shoulder and Arm Disorders. Exercise 5, page 15. Conditions of the shoulder, arm, and hand. Many common degenerative conditions and injuries affect the shoulder, arm, and hand. These conditions can be painful, requiring continuous treatment or surgery. Conditions such as tendinitis and bursitis affect the joints of the arm. Tendinitis is caused by damage or degeneration affecting the tendons. It can occur in the shoulder, bicep, elbow, wrist, and hand. Bursitis is caused by inflammation of the bursa. It occurs most often in the shoulder or elbow. Bursitis is also common in the knees. The shoulder. The glenohumeral cavity houses the head of the humerus, forming the shallow shoulder joint. The shoulder is the most common joint in the body to dislocate. The elbow. Painful conditions affecting the elbow are often caused by inflamed tendons. Lateral epicondylitis, frequently called tennis elbow. Medial epicondylitis, frequently called golfer's elbow. The hand. Hand deformities affect the joints in the fingers. These are caused by problems with tendons on the back of the hand. Swan neck deformity. The middle joint of the finger is hyperextended, while the joint at the tip of the finger remains bent. Boutonniere deformity. The middle joint of the finger is slightly bent, while the joint at the tip of the finger is hyperextended. Unit 7, Hip and Leg Disorders. Exercise 5, page 17.
Disorders of the hip, leg, and foot. Many disorders of the hip and lower extremities are caused by overuse. Muscle strain occurs as the result of physical exertion or degeneration over time. Painful hip syndromes are often associated with tendinitis or bursitis. Muscle pulls in the hip are common. Any of the muscles in the hip area can experience trauma. Causes include strain or repetitive use. Trochanteric bursitis causes pain in the lateral hip. Pain can extend down the thigh to the knee when tendons move across the bone and the inflamed bursa. Ischiogluteal bursitis, or Taylor's bottom, causes pain at the base of the hip bones. Swelling can irritate the adjacent sciatic nerve, causing symptoms of sciatica. Disorders of the knee and injuries to the meniscus cause pain and inflammation. Prepatellar bursitis affects the frontal bursa of the knee joint. This causes swelling and pain above the patella. Muscle pain in the shins is common among runners. Shin splints are innocuous and should be treated with rest and ice. Pain in the feet and toes is often caused by gout. Joint and toe deformities also cause pain and stiffness. Deformities of the big toe include claw toe, hallux valgus, hallux ridicus.
Unit 8, Surgical Intervention. Exercise 5, page 19.
At Chalmers Physical Therapy, we take our patients' surgical procedures seriously. We offer preoperative and postoperative management to provide you with the best care. Preoperative management consists of the following: a comprehensive examination to determine functional status before surgery, an evaluation to determine a patient's needs, goals, and surgery outcome, patient education, including information about the surgical procedure and after-surgery care. We'll have a rehabilitation plan prepared for you immediately after your surgery. It doesn't matter if you had a tissue graft or a reconstruction. Our goal is to get you safely and quickly back to your normal daily functioning. Post-operative management consists of the following: examinations before each therapy session with special attention paid to incision sites, guiding patients through the 3 phases of recovery: maximum protection phase, controlled motion phase, minimum protection phase. Post-operative rehabilitation plans are based on the type of surgery. Some patients have open procedures, and others have arthroscopic procedures. Others have a combination of the two, arthroscopically assisted procedures. We evaluate you for post-operative complications at every session.
Unit 9, Medications. Exercise 5, page 21.
Physical therapist, Adam Greenwood. Patient, Timmy Gonzalez. Age, 22. Injury, spondylolisthesis. Source of injury, sustained through continuous wrestling. Patient is on his college wrestling team. Recommended treatment: corticosteroids should be taken at a high daily dosage for the next 2 weeks. Afterwards, the patient is recommended to take a daily dosage of analgesic. A topical cream will also help alleviate the pain. The cream ought to be carefully massaged in the affected region of the lower back. The corticosteroids might result in side effects. Should they be severe, the patient is advised to stop taking the medication immediately.
Physical therapist, Dr. Anita Sanders. Patient, Wendy Wallace. Age, 79. Injury, cervical herniated disc. Source of injury, continuous strain and aging. Recommended treatment: a prescription for a localized anti-inflammatory is recommended for the patient. If the pain persists, the patient may further medicate. I would suggest over-the-counter NSAIDs, such as a high dosage of ibuprofen. It's advisable to set up an appointment in order to learn specific physical exercises targeted for her lower back pain. A daily exercise regimen must be followed for the treatment to be sustained.
Unit 10, Preventative Measures. Exercise 5, page 23.
Preventative measures. Disease can be the result of genetics, lifestyle choices, or a combination of the two. We cannot control our genes. However, we can avoid poor or worsening health with preventative measures. There are 3 main types of prevention. Primary prevention. This refers to measures taken to decrease the likelihood of illness. This can include basic measures, such as getting vaccinations. It also means having a healthy lifestyle. Healthy lifestyle choices include the following: not smoking, limiting alcohol consumption, eating a balanced diet, maintaining good personal hygiene, avoiding inactivity, applying sunscreen, focusing on stress reduction. Secondary prevention. This refers to measures that lessen the duration and severity of illness. Individuals who detect potential problems early often do better. That is why screening and testing are key. Tertiary prevention. This aims to improve quality of life for people with diseases. The focus is on slowing the progression of disease. How physical therapy helps. Physical therapy can also be used as a preventative measure. A physical therapist can identify the following kinds of problems: muscular, skeletal, neurological, cardiovascular. Your physical therapist can create a customized treatment or exercise program. A supervised fitness program can improve your current and future health.
Unit 11, Specialties, Neurological and Geriatric. Exercise 5, page 25.
Information. About us. Contact. Zipman Wells Physical Therapy is a group practice. Our specialties are geriatric and neurological physical therapy. We concentrate on assisting the elderly and aging population. As a result, we have a lot of experience in geriatric diseases. We regularly work with patients suffering from the following ailments: CMT, Charcot-Marie tooth disease, and other common genetic diseases; cancer; Alzheimer's disease. We do see patients with moderate to severe Alzheimer's disease. However, we request that a caregiver accompanies these patients. This reassures the patient. It also allows us to collect an accurate medical history. We also help patients who need joint replacement surgeries. We draw up a regimen of exercises before surgery. Then we visit patients in the hospital post-surgery. Upon the patient's release, we continue rehabilitation on an outpatient basis. We are affiliated with a number of local hospitals. All of our physical therapists are certified in neuromuscular therapy. This is designed to rebalance your nervous system and musculoskeletal system. Sometimes our patients are not physically mobile. In such cases, we offer house calls. We also make visits to hospitals where we have privileges. Please contact us if you have any queries. We are always willing to provide referrals.
Unit 12, Specialties, Orthopedics. Exercise 5, page 27. www.orthopedicsplus.com. Orthopedic Services. Orthopedics can help treat a wide range of problems. Patients suffer from sports injuries, arthritis, back ailments, and muscle pain. We identify your ailments and find the treatment that is most suitable. Here are some of the services we offer here at Orthopedics Plus. Dry needling. This service is similar to acupuncture. It is used to relieve muscle pain by addressing trigger points. Electrotherapy. Used for chronic pain, tissue repair, and improving range of motion. Iontophoresis. Used for the application of anti-inflammatory medication. Cryotherapy. Decreases acute pain and spasm and decreases inflammation by constricting blood vessels. Instruction of stretching exercises. Provides rehabilitation for lumbar pain, twisted ankles, and muscle strains. Ice packs are available for extra relief during rehabilitation exercises. Amputation. Our 2 in-house orthopedic surgeons offer this service. Severe infections sometimes require the removal of limbs. Though this measure is sometimes necessary, it is also painful and traumatic. Our surgeons will guide you through the process. Our physical therapists will also guide you through the rehabilitation process. This includes strengthening the remaining limbs. It also includes helping you get fitted for braces and prosthetics. Orthopedics Plus has been in business for 25 years. Our staff members are skilled and attentive. Unit 13, Specialties, Women's Health. Exercise 5, page 29.
Physical therapy for women's health. From the time a woman conceives to a year after childbirth, her body goes through various changes. As a result, the woman may experience discomfort during and after pregnancy. Physical therapy helps women to understand and treat these problems. Such therapies may include relaxation, breathing exercises, and stretching. Prenatal physical therapy can reduce complications during childbirth. For example, perineal massage during pregnancy can reduce vaginal tearing. Sometimes symptoms persist postpartum. Back pain is common. It may be experienced in the upper or lower back or in the tailbone. Pain can be alleviated through correct posture. Women may also feel pain in the leg or foot due to sciatica. Urinary incontinence and constipation may also continue after pregnancy. These usually result from weakened pelvic floor muscles and tears in the pelvic floor. Physical therapy can stretch these muscles and optimize muscle length. This helps to mitigate unpleasant symptoms. Pelvic pain is also common after a C-section. The pain is caused by adhesions which form as the body heals. Physical therapy can reduce these adhesions without the need for surgery or drugs. If you think you would benefit from physical therapy, contact your nearest therapist at your local clinic.
Unit 14, Specialties, Pediatrics. Exercise 5, page 31.
Welcome to Chatsworth Pediatric Physical Therapy Center. Our goal: provide uniquely specialized, high-quality physical therapy for children. Our highly trained practitioners work with each child based on his or her unique needs. Through individualized treatments, exercise practices, and care, we supply the best physical therapy treatment possible. What we offer: we offer specialized physical therapy pediatrics for a wide range of ages. We see all ages from infants to adolescents. We design fun, easy physical therapy exercises to help build motor skills and refine natural coordination. We know that children need to have play integrated to their exercise program in order to stimulate them. Exercises are specially designed for each child. Parents are encouraged to sit in and watch physical therapy sessions. Then they can replicate the exercises at home. We have lots of experience in sports medicine. This includes providing acute care for serious injuries and a rehabilitation plan. Pre-participation screening tests for sports and different activities are also available here. Our specialists provide treatment for developmental problems stemming from neurological diseases such as cerebral palsy. All our physical therapists are trained in neurodevelopment treatment, NDT.
Unit 15, Education. Exercise 5, page 33.
University of West Victoria, School of Rehabilitation Medicine, Physical Therapy Degrees. Until about 10 years ago, the University of West Victoria offered physical therapy as a BS degree. Now we only offer it as a MS degree or a PhD. Two types of MS and PhD are available: entry-level and transitional. Entry-level degrees are suitable for candidates who are new to the study of physical therapy. Transitional degrees are suitable for people already working in physical therapy who want to update their knowledge. Prospective students must meet the following minimum academic requirements: 3.0 grade point average overall, 2.0 or higher grade point average on each physical therapy prerequisite course. Applicants must have a bachelor's degree. There is no preferred major, but most applicants will have degrees in biology or psychology. Applicants will have completed the following prerequisite courses as part of their undergraduate study: physics, chemistry, biology, behavioral science, anatomy, and physiology. Both the MS course and the Doctor of Physiotherapy DPT courses include classes in biomechanics, kinesiology, neuroscience, and clinical pathology. New classes begin each quarter. Enrolled students complete over 150 required credits, and the average load per quarter is 15 credits.
AVN Pharma Education.